Good evening, everyone. We welcome you to this live talk, a program with doctors, a program on decoding COVID-19 vaccine, a program to wipe away the misconception about the COVID vaccination and to inform you about the reality of the COVID vaccination. This program is brought to you by the National Health Mission, Government of Meghalaya. Kublay yapi baro, yipriang sobha yapi shakanika program, kabala pinbit pinbyang lengbaka National Health Mission, jongka Sorkar Meghalaya. Kajing tumu jong kanika program, kalong ban pensyay yapi, halor ketika yada na kajing pang COVID kat kandai. Ya kanika program, yin le alang dakaktien parang, but dakaktien kasi. This program will be both in English and in Khasi. Nadu ka khandru tarik January 2020 ka Sarkar India kala pelat ya artli kita kitika banyada na ka COVID kat kandai. Kita kilong ka Covishield but ka Covaxin. Hang ni hapo Meghalaya jungi la pelat ba nadu kata ka khandru tarik jong January arpuai ya ka Covishield but hado hinden kasngi kata kat kandai tarik ubanai Jun 2000 arpuai ladan kumba sanlak kat saw hajar sanspa nyopu prangut gibriu kibladep yo lani ladep shim ya kane ketika. Friends, ever since India rolled out 2 vaccines for its people, that is the Covishield and the Covaxin, Meghalaya got the Covishield vaccine and over 5,14,578 beneficiaries have taken this vaccine. We have noticed there is a lot of eagerness in the young people to get vaccinated against COVID-19. But there is a hesitancy amongst the older age group. This hesitancy may result primarily, around debates on medical, ethical, and even legal issues related to the vaccines, especially since these are new vaccines. But the vaccine hesitancy can also stem from other multiple factors. The WHO have defined vaccine hesitancy as a delay in acceptance, or it is a refusal to take the vaccine despite its availability or despite the services that is being provided to give the vaccine. Paralog mentakas ngingin ya keren syapang kajing artatien panshim ya ka vaccine lani kani ka inject ka banyada na uni uknyang COVID kat kandai. But kebun kidaw shisha kibangin saya keren menta bali ba kibriyo ki syaptiang banshim ya kani ketika kaban ai kajing yada yaki. Nga sotanat ban pentip syaphi babat ni menta idan lainwat ki doktor ki balat tibet bah ka kam ke jongki bat kini ki doktor ki dan bat ni ban ai kata ka jing shai ban ai ka jing batai syapang jong uni u inject lani kani ka inject ka ban yada yangi na ka COVID-19. This evening we are very fortunate to have with us a group of experts who will help us to decode COVID-19 vaccine and demystify the myth and misconceptions surrounding the vaccine. We will also be taking some questions and there will be live audience with us who will be asking us questions, and we hope that the panel of doctors will be able to answer them. With us we have Dr. S. Bala. He is the Assistant Professor Community Medicine from Negrin, Shillong. We have Robert R. Marak. He is District Surveillance Officer, East Khasi Hills, Shillong. We also have Dr. Meban Kharkongor, medical specialist from Dr. H. Gordon Roberts Hospital, Jayao, Shillong. We hope that at the end of this discussion, our citizen will come to us to an understanding as to why we need to vaccinate the maximum people of citizens. We hope that by taking the vaccine, we will be able to stop the propagation of this disease and arrest the spread and the coming of the third wave. My first question will be to Dr. S. Pala. I will ask this question in Khasi. Dr. Pala, kadang kani ka jing snow hangi ki ba? Makani ka vaccine bala pelat si kibril, kadang day tang halpo ka experimental stage. But laong bala pelat ya kini artili ki vaccine, tang kum kata ka emergency use, ani ban pendan kam sipor ya ka, but ban pendan kam namar ba kadang kani ka pandemic nila ban ong. But ya ka trial ru ki ong ba kadang don nang haka phase 3. Pila mo ban pasyat lani pasyat jing syai syapang kani. Friends, my question to Dr. Pala is about the vaccines that have been rolled out, whether it is still in the experimental stage, and whether if it is true that even the third trial also have not been over yet. So we would like Dr. Pala to explain to us about this.
Nungkong daga kasi kade ba piyong ba doktor sibolet ba uniu vaksin COVID kharkhandai udang don haka experimental stage but ladon haka advance jong stage ka phase 3 mo ka kata ka phase balai de kade ka phase bakhadu sawan pandan kam ya uniu dawai vaksin hende kumba piti ba uniu vaksin la sna but ka company na UK mo na England but ka cooperation but ka India ka UK kalale ka experiment kalaya sakmat kita ka phase 3 trial nado macam senam but kalami ki result hado December ro kali ba uniu vaksin jong COVID-19 mo Covishield bangi pendan kam po Meghalaya ulong uba bangila ban ai ki patba ki ba khatras nem seneng namar ya ka eksperimen kile ya ki khatras nem seneng te ka sarkar India ru ka pej ba uniu dawai ula ban ai jing yada na gani ka klam ha ka por ba dan kam kerki kum ha gani kalong emergency na kata ka daw ipedan kam yo uniu vaksin but hapo India ru la sedang ya kata ka eksperimen ka de ka phase 3 mo phase balai nadu August ar hajar arpeu baru ladep analyze ka interim report hau nai April mentau senem teki ba kamdon kajing ma na bentaban pendan kami uniu vaksin tekaya sakmat but ki don ru ki studies ki bapen ba uniu dawai vaksin u ai kajing da ka bakrau khamtam ya gitu ke bahable hospital ini yada na ka jingpang covid ke bakham sakhe baru banyada na ka jingyap. So I'll say in English this vaccine Covishield, I'll talk only about Covishield because we are using Covishield in Meghalaya, is developed by Oxford University from United Kingdom, England, and with the Serum Institute of India. So the experiment stage is going on. Even after phase 3 also, we see now different vaccine at different stages. So this AstraZeneca, or we say Covishield in Indian version, phase 3 has been conducted by in UK, Brazil, South Africa since last year, and they have found interim report and also the report which is going on now, interim report in December. They found this vaccine is safe to be given for 18 years and above, and that is good. Based on that, India also may be taking all the evidence from all over the world, and the government also decided that this vaccine should be used on emergency use. So emergency use authorization, India has the right to choose to use the vaccine when it has cleared the phase 1 and phase 2 clinical trial, so that this Covishield has been used. So now even the Indian version of Covishield phase 3 trial has started in last August and it's going on. Interim report has been submitted to government in the month of April, and the government also examining it, but it's not yet public. But hopefully this is good. Since in more than 50 countries, people have used this vaccine on emergency use authorization. So this vaccine is, yes, definitely in the experimental stage, but also it is found in the experiment that it is effective and safe to be used.
Thank you, Doctor. Doctor, ngi ong ba kani ka day ka experiment day, but bon sien ki brio ki snow ba kani ka experiment ba pelong ki pat ba kum kita ki test subject. Hatu kani ka experiment ka pen khen ni em ya kata ka article iway jong ka Nuremberg Code khat khandai sa punyo ba kata ka article ka bahan rio jong ka UNESCO statement on bioethics and human rights. Pila an pen syai Doctor halor kani. The question that I am asking Dr. Pala is he have told us just now about us being that the vaccine is on experimental scale. So the question to him is that, is it true, doctor, that the human population has been used as test subjects as part of the experimentation of these new vaccines against COVID-19? And if the experiments conducted have broken any of the the codes that we have. So, for example, of the bioethics and human rights article, example, the Article 1 of the Nuremberg Code 1947 and the Article 6 of the UNESCO Statement on Bioethics and Human Rights. Doctor, can you please clarify on this?
Kebetulan doktor, actually kebahaban pensai kebaik ini ya bun kebaik ba ki om bau ni doa dan ngile eksperimen ke sarkar kala eksperimen ngi mendai kumta ya ka eksperimen kaya laga jong banle eksperimen ke sarkar ke don ki rule ki ba perking bha mo dam ai board ke sarkar India kino kimla banle eksperimen ya tika jingeda leni ki vaksin mo kini ke sarkar India kala ai tangi khasan teli ki hospital pori India kilale eksperimen tang ye khan rius pa nam ta Covishield but ar kusan hajar nam ta ko vaksin tang kita ki eksperimen ni ngimde ki eksperimen apo Meghalaya mudon kata ke eksperimen haba mudon kata ke eksperimen teng kata ka Nuremberg Code ke badan kambha haki study mo baru ki study dangale cukli pitang ka kerteng tang ka jairu ngapan permission nathi kata ke consent banung kongdo kata ke Nuremberg Code ke bangi pan bor sa nathi ngala ani eman kili fi khendiat ngaba ban tips phang jok fi bari kata rungi hapan bor mo hende ye kan ni ke jing ye ka to ka article 6 jong ka UNESCO bioethics su ka to ro ka dei bangin pen subo dangi wan sapi ngi pen sai fi o ngawan dan kampung ta ne negrim ngapa ban kili fi ngai fi information bat ka consent mut ka jing manjur jong fi hendre hangni don kam kata ka jing manjur namar yeu new do vaccine tika jing eda na ka coronavirus ngim don kata ka jing le experiment ngim don kata ka study te kene gelong kumba ni ai kum ki pat ki vaccine ki pai ba kin wan sim ki vaccine te kam don kata ka jing pengkhen ya ka ain jong ka consent of Nuremberg Code leni jong ka article 6 jong ka UNESCO of bioethics. So I would like to share this maybe some misconception people have that okay the government or the country is doing experiment on the population of India or maybe Meghalaya. No, there's no experiment in Meghalaya. The Covishield experiment, which has been done, is only in 15 center across the country. That is only 1,600 individual. So for that, they will take the consent, they will take everything. Very strict rules there for doing a clinical trials. That is phase 3, and also 25,000 for Covaxin, which Covaxin also they have given the interim report in March, which find quite favorable results. So those are the study subject. They are very minimal, you can say, only in thousands. But you see, in India, we have given more than 25 crores of vaccine now, both majority by Covishield and Covaxin. So they find that this is quite safe, and this use of vaccine has nothing to do with research. Okay, definitely we can utilize the evidence available, but it is not purely research. It is just evaluation or analysis that they find people, those who have vaccinated are getting the benefit, and those people who are not vaccinated are having some disadvantage, especially for hospitalization, severe disease, and also for even death. We see so many death. So vaccine can prevent death. So there is no study on the population of India, except only small number.
Thank you, Doctor. I think that is very clear. In fact, these are the issues that have been brought into our notice, and it is an issue that has been raised in so many social media forum. I have a question for Dr. Robert. Dr. Robert, Kidan ru ki kubor ki baong kat kum kata kaya European Database of Adverse Drug Reaction na benta un kini ki COVID kat kendai injection ki lapen sapria ki bala sapriang bah po Europe ki ong ba kadon kini ka jingyap na kini ki experimental vaccine ba kata ka jingyap kalong ka bashir khai ba ka jingpang ru kalong ka bashir khai Yau AstraZeneca kata kapalong inject ko ba ni ai ko Covishield sini siya India. Yau taruh ki ong ba udan wan ra shibun kita ki jing shitom but dan kat tu kat ni ki jing yam. Pila doktor ban batai khamshai shapang ni. Doctor, as per the European database of adverse drug reaction, it has been reported that there were a lot of deaths and there were a lot of people who were suffering from adverse effects following immunization after this experimental vaccine. And in fact, they have also stated that AstraZeneca has caused many people to be sick and also has caused, some deaths. Can you give your opinion on this, doctor?
First of all, a very good evening to you, madam, to all the panelists as well as all the viewers. So, the question which you have asked is very, very relevant and very, very important, I feel, at this juncture where people are hesitant to come forward and receive the vaccine, which is very much cost effective and life saving at this moment. Now, if we look at the European database of adverse drug reaction, as far as my knowledge goes, there is no document stating that this vaccine, Oxford AstraZeneca, or the Covishield, which we have in Meghalaya, has caused deaths, as you had stated, in the European countries. Because I think the data which you received must be from the anti vaxxers website. Now, you know, we have lots of anti vaxxers outside the in the European countries. We also have anti vaxxers right in our state and in our country. But if we want the correct information, I think we should check the facts and go to reliable websites. Like for our country, India, we have the Press Information Bureau, and that is the website through which we will get the correct facts about the various AFIs or deaths, if any, which have occurred in the country due to COVID vaccine. As far as my knowledge goes, till date, we have only one death which is being reported due to vaccination, and that too has been reported only on Tuesday, this Tuesday. So that is regarding one person who had his vaccine few months back. That was on March 8th, probably, if I've not mistaken. So as we know, vac- vaccine may cause different type of reactions or adverse events following immunization, which we term it. So there are minor AFIs as well as major AFIs, and only 0.002% of people have been reported to die due to vaccination. That is very, very minimal, right? 0.002%. Now we have to weigh the benefits as well as the risks. Now, if we see, if there is only 0.002% deaths due to vaccine, I think we should go for the vaccine which is cost effective, uh, as well as protective at this juncture where we are having more than 2% fatality due to COVID infection. 2% means 2 of every 100 cases of COVID are dying due to COVID infection. So, my only request is that before we listen to such news, the anti-vaxxers news, I think we should do a fact check first. Ti ngatray ngan batay kandiat daga kasi na markani galong ka ba kabadon kambha ha ini ipor ha kabangi iba bon naki social media kipen sapriang ya kata ka kubor ba nyimdai ban ai vaccine lane ndala adab ai vaccine kibon kibala klat na uni u vaccine lane kibon kibala yo ya ka adverse events na uni u vaccine ti kawai ngaku aban ong ba hadu menta 4 don mano-manoru ba klat na uni u vaccine ngidang yo tang uwe u ba klat na kaniga vaccine but kataru ngimla ban syuang ba uklat naga vaksin. Ngidon ka AEFI committee, ka state level AEFI committee, ka national level AEFI committee, ki panel of experts na kiwe ki specialities ki ban investigate yakum kini ki breu ki baklat ndala adab ai vaksin. Titakadaw ka sarkar ko ang bakalong ka ba donkam ya ki breu bakin up kumba shiteng kanta hadin ba PI ya uni vaksin. Namar ladadon severe allergic reaction. Hano hadin ba ay ganiga vaksin kata ka severe reaction kan develop tang hapo lipo minute. Takadaw Maria ay vaksin ngimday ban krat no nga tuga jaka ngimday ban up shua kumba shiteng kanta hakaba ki doctor lani ki nurse ki ba ay aga vaksin kin check yapi kin pet yapi hato pi don na am kano ka reaction na kanega vaccine. But ka health ministry kalaong ba na uni u vaccine u bala test kung balaong i Dr. Star pala menne bala adab le ki clinical trials third clinical trials ru kila adab dep ya uni u vaccine but ndala adab test hi ki pha shini sa India but ki pha shini sa Meghalaya khnang bangin la ban vaccinate ya ki pajba jongi tika health ministry kala penmi ya ta ko khubor ka baong ba tang point not R% nakibayo ya uni u vaccine kila ban klat naka jingpang ndakiyo nday naka jingpang sorry naka adverse reaction ka bakila ban yo na uni u vaccine tangba ladang ipek tang ha Meghalaya ru lada phimyo vaccine fishu shabet ba phin yo ya kaniga jingpang ngiu iba R% nakibayo ya uni u COVID ki klat no. But umday tang kata ka R%, R0% ki badan comorbidities kitaru ki klat no na kaniga jingpang namar kimla banyale persya ya uni u jingpang. But ladang ipet ya ka percentage jong kiba ki elderly kiba haneng ya ka 100% karta ngiu iba khatsan percent na ki elderly ki ba yo uni u jingpang ki klat no na kaniga jingpang ti ka request jonga ka dei ba ngimdei ban ngap ya ki kubor lamler ki ba sapriang ha ka internet ndrei ngi dei ban perkhat ba hato ka kham kordor ka jingim jong kini ki R% ki ban klat no da ka ba yo ya kaniga jingpang ne hato phi kwa ba phinum yo ya ka vaccine but phi kwa ba kita ki R% kin su klat no na phi kwa ka jingyada na kaniga vaccine hakaba tang point not R% na kibayo ya ka vaccine kila ban klat tang kata ngala ban ong but shwa ba phin ngap ya kita ki kubor lamler ngatrai ngidei ban pet shwa ya ki facts ma hato ka dei shisha na am kumta namar ki bon ki breu ki basu pen sapriang ya ki kubor lamler namar ba kim kwa ba ki breu kin yo jingyada ladang ipek tang naka accident ru kat nungut ki breu ki baklat accident da ka ba kim deng helmet korban ya bike tang ki baklat naka ba di kiat ru kat nungut syu ki baklat tang ki baklat naka cancer haba ki bam duma ki bam kuairu kat nungut syu ki baklat ya katangim perkat ngitip ba ladangi bam kuai ngila ban klat na cancer ladangi di duma ngila ban klat na ka cancer oral cancer ladangi di kiat ru ngila ban klat ladang ngimdeng helmet nginia bike ru da ka accident ngila ban klat ya kita ngim perkat tangba lada point not R% jong ki bay nakini ki bay yo vaccine kila ban klat kata kala adai ka khubor ka bahe te kasyong ha iway pa iway nangi kumno ngi rai bat kumno ngi perkhat kumno ngi pendan kam ya ka knowledge bat ka intelligence ka jongi tangkata ngadon bandang doktor.
Kuli shibun Dr. Robert. Kaji so tu jonga kalong kumdi ba kibun kita ki anti vaxxers. Mo ki brio ki belong persya ya ki vaksin. Ba kini kim persya tang ya kani ka COVID vaccination. Henry ki persya ki wei pada ki vaksin ki bangi ai na benta ki kelung ba nilai i ha ki ri jong syakiti ki western countries. Mo ki babun ki brio kim tre ya ka vaksin ba nilai i ba kadon ka measles outbreak ru hapo Amerika nangkat kini kendiap senam ki baladap namar balai ba kim tre ya ka vaksin tingi ngi hap long ki ba start ki doktor la batai bah bana ki shispa angut ki ba yo covid arngut ki yap ba kani kamde ba ka jia shuru ki benta jong ke India ka ja hang ni hapo Meghalaya ka jongi bat ki ba yap pat na kata ka vaksin hang ni hapo India dang wei urang ba ki ba sarkar kala pelai ba uyap na ka daw jong ka vaksin hari kani ka day na benta ba uni orang ba ulami no klam da syong ya kita ki lai pau minute bo hab ban syong kata observation period namar bo develop allergies ba ula klat handai la rejin bo la syong ya kita ki Shitang kata la kita ki lai pau minute ki nurse jongi ni la ada train ki ni don kita ki kids ki bangi la penbiang bala don kanu ki eventuality dan ni kanu kata ka jing bamiade kada wai kilala ban sumar yaki kilala ban ai inject yaki Dr. Robert nak kuat ban keli pi pila tri bahai gani ka kam ko be day bat ka COVID-19 mo po uniu jingpang COVID nang ta pat dia naduk ka senam mensyam senam hi jar arpau but ka IDSP hi kala le shibun ki kam yo bah ka ban ye le ban penduna ye uni u kenyang na ka jing sapriang ka ka ba pi phala man ta ka senam doktor namar ba habangi pet yakini ki data ki bayap ni isan spa tam total henry sau spa tam tang hakani ka senam lani tang hakini ki benai me ba june pila doktor ban batai shi khandiat chapang uni khnyang la ukham german ta udi ujo kum men sham senam ne kumno ulong uni khnyang doctor is there a difference between these the COVID 19 virus that have affected our people last year and the COVID-19 virus that have affected the people this year, whereby out of 500 plus deaths, 400 plus alone died in May and June. Can you elaborate, doctor, on this?
Yes, doctor. See, last year we had our first wave from 13th of April where we detected our first COVID case. So the cases started increasing till December 20. That is when our first wave ended, December 2020. Last year, during the first wave, the number of cases we had was 13,427, and the deaths was 139 in our state. The case fatality rate was 1%. That is, one of every 100 cases died due to COVID. Then we had our second wave from 1st of April 2021 till yesterday. I have the data, that is 19th of June 21. We had about 30,831 cases and 626 deaths. So if we calculate the case fatality rate, it comes to about 2%. That means 2 of every 100 cases died after getting this COVID infection. So definitely, if we look at the case fatality, this virus during the second wave, the Delta strain which we have in Meghalaya, is not only highly infectious and highly transmissible, but also highly lethal. So, my only request to the community is that if we want to stop the transmission of this virus, and if we want to reduce the deaths which is happening to our near and dear ones, our loved ones, our friends in this state, the only method, the easiest method, cost effective method, evidence-based method is vaccination, vaccination, and vaccination. And that too, vaccination coverage of more than 70% of the population. Unless we cover more than 70% of the population, we are still going to see more deaths in our state. Not only 2%, maybe 3%, 4%, or more. We can't say how the virus will be from now on. The virus we know keeps replicating. So that is why we need to take the vaccine as early as possible. Tinga kwa ban keren khendiat daga khasi. Ladang ipej ha ka first wave. Ka first wave ngiyo nado u April menchim snem hadu u December menchim snem. Ti ladang ipej ki number of cases bangiyo ngiyo kumba khatlai hajar sauspa arpon nyongot ki case ki bayo ya uni COVID. Bat ladang ipej ya ki breu ki baklat. Ki dan kumba shispa laipo khendai ngut ki baklat na uni u virus menchim snem. Tika case fatality menchim snem kadai tang 10%. Kamut iway na ki shispa ngut ki bayo ya uni u virus kila klat na kaniga jingpang COVID. Tangba ladang ipej ha uni u snem pade kaniga second wave kabala sedang nadu shitarik u April arhajar arpaway hadu menta kamut kadang yat tang kumba arbanai ngilayo kumba laipo hajar praspa laipo wengut kibayo ya kaniga jingpang. But reus pa arpon nyaungut na kita kila klat. Tika case fatality kabangi ken hakaniga wave kabaar kalong kumba arpersen. Kamut arpersen na kisispa ngut kibayo ya kaniga jingpang ha kaniga second wave kila klat. Kata kamut ayu. Tang hapo arbanai perkat arpersen na kibayo ega jingpang kila klat. But ladang ipej ya ka case fatality ka kham jor syu hakiba kham he karta. Kawan kumba khatsan persen ka case fatality hakiba kham he karta. But ladadon kino kibadan kano ka jingpang. Ki comorbidities kumbangi ang barobor ma kibadan BP, kibadan shini, kibadan cancer lane kiba duna ka bormet. Kiba long immunocompromise. Ka case fatality ka kham jor syu haki kalong kumba arpo 9%. Tiladang ipej ya kaniga data kapen isyai ba uni u virus u delta variant uba menta ubala sapriang saudang keleng saudang udai uba kham itrem syu uba kham shirkhai syu bat ubala ban shim ya ka jingim jong kiba e ba thonjongi tika e ka bangila ngidai ban le lada kalong ta ke protection ka bangila ban ai ka evidence base ka ongga sarkar ka bangila ban ai ka dai tang na ka vaccination bat da ka ba penbut ya kita ki kendon baro ki covid appropriate behavior ka ba ka sarkar ka ong habang itip kumno ka jingpang kumno uni u virus u sapriang tingidai ban wat ya kita ki lat jingyada virus u sapriang kumno tang hakapor bangi kren leng baka jenhau ndai hak bangi kren lane por bangi senria ni virus umi naktin jongi bat usap priang bat sakawe ngaku aban ong ba 90% nakibayo ya uni u jingpang kempen i yaki dak kishin kataru ngide ban sungtho syai haban 90% nakibayo ya kaniga jingpang kimpen i yaga dak kishin yaki dak kishin kamut perkhat hadu kat no syu kini ki pamdan ya ki dak kishin kinang pen sapriang hakapor baki kren hakapor baki senria hakapor baki ki sam ya duma ya kwai bat ki parlok jongki kat no syu kila pen sapriang ya ga jingpang tiladangi kwa bantip ba hato ki ba iet ba thonjongi ki don na am ya ga jingpang ngidei ban lej ban test ban tip ban lap ba kidan na am ya ga jingpang ladang im test nginum la ban lap ya kata bat ndang ila test ladang yui ba ulong positive bran ngila ban isolate no yu tau breu bat ladang i isolate yu breu kamut bangi isi yu ngi isolate yu kamot bangi isolate ya utau virus ubala ban pensapriang ya gajingpang. Namar utau virus udon tang hakamet jong tu brio. Ubalong asymptomatic, ubam pen iya gidak kishin. Kawai kadai kata, bat kabaar kadai ka vaccination. Ladangi kwa ba ki brio jongi kinum klat bat kani gajingpang kanum sapriang syo. Ngidai ban penkloy ya karukom vaccinate jong ki eligible population group jongi kita kidai kiba khat pras nem shaneng. Kamot 90% naki eligible population jongi kidai ban yo bran ya kaneka vaccination. Ladang
Hi,
imyo ya vaksin
Dr. Robert.
Yes,
Dr. Robert,
Ah.
when on kumni mo nga mentan nga batay ya ka taka fertility rate but ya kan ya ka death ka baja hapo East Khasi Hills nga so kumen chibun ba pila batay ya ka Meghalaya hi ka bala don pala ndrus pa arpun riu ngut ki bayam. Dengan itu ya kata jing so kya ka jong pi namar pi day district surveillance officer jong ke East Khasi Hills. Hato to ya tho lam yangi kat nungut hapo East Khasi Hills na kita kin ndrus pa arpun riu ngut ki baklat. Kat nungut ki baklat na po East Khasi Hills. Doktor?
Kiba klat hapo East Khasi Hills kidan kumba sanspa new pungut total hadu mentah.
But South Spa tam gide giba klat tang hakini ki umie bat hau new June day doktor.
South Spa tam.
Right. Dak kubli si pun doktor mentangin keren sia I doktor mi ban karkongor. Doktor pi pila sumar si pun bah ki brio ki ba shitom na kani ka jingpang COVID. But ngakwa menteli pi arteli ki jingkeli kawai kat kidapoi po hospital kum kinu kita ki dak kishin kidon. But kabaar ngakwa ban keli pi balai bagi pait ba kidang onghi ba kani ka jingpang COVID kat kandai ka jingpang ka ba shuthok. We have with us here Dr. Mirban Karkongor, a medical specialist from Robert Hospital. We are very fortunate to have him with us. And my question to him is this. He has seen and treated many cases of COVID. So I want to ask him what are the signs and symptoms of these COVID cases who reach the hospital. And second, why people are still, saying and, giving false information that COVID-19 is just a scam. It is just a lie. Doctor, kindly elaborate on this.
A very good evening to one and all. Kublai Shibon, Dr. Khongla. Kadai shisha baong ba ngilayo I bon ki nongpang hagini ki benai ki bladem. Hakajing snow jongali te ngasnow ba nglayo I too much bang layo I wakila bon shaka bapalan. Te hakaba habao nongpang u wan shaka hospital kidon hado lai rukom kumno kinwan shpok hospitals. Wei beningkong kelong ba kiwan baong ba don ba positif hayeng ngam das ngau peri dengan syukur menwan test sila dia menwan pet hatu nga ru nalong ini kita kiba layo day buat tahu kenyang COVID-19 bangiang. The second kaka bahak kabaar pat kadai kini ginong pang kibapang malu mala kinwan kinong doktor nga syu bayong clear sat don jerho malu mala kedon kejing tamet ngam da bam dadi ngam da yo snow shi ngam da yo syu ya kejing mat ya kejing sma ngam da snow thu syu kedon kejing saw ki khat kendiat kensat kedon kejing tha clear te kita kidai kabah kabaar kabawan sa si benta na kinong pang ki bapoi sya ki hospital spot ki wan dala dear por palat te kinwan da ka baong bangamla ring mensiam satya syu but kidai kinehi kinong pang kiba lakham jur ka jing stom te habang ipet ya ka jinglong jong ka jing stom COVID-19 ha kiburiu kiba long positive but kiba long symptomatic mut kiba penpawi kijing stom sebar ngio iba hakisngi kiba ki hakisngi kiba ningkong jong kijing stom kin don tang kijing per jong kamet kumba bayong khle mungkin syuk tha kli tha met tha pha malu mala kum tu bangala batai menne hadin kata kan sedon kat tu kat nisngi ke ba hadin kat tu kat nisngi kin sesngo pungat no te kan ni ke penlong yaki ban sngo shngan ban ong em kadai tang ka bayong Henry na ki brio ki ba poi shaki ICUs ki ba poi shaki hospital ki ban kam oxygen shibon ki ban kam ban ai ki dawai ki ba kam klan kini pat wat la ja ya ka tu ek ka ba ki yo sngo ning kong ha ka sngi ka ba nyo ka sngi ba pra ka ba khandai ya kum kini ki sngi ba ka wan pai biang sien ba ka jing stam te kamot ki la ban bayong khli khniat kan soi ki jam no ba bon balang na ki numpang shu hiru te kamot ki la recover ki la jam ndai don ka tu ka ne pat ki ba kham shitam ki wan kham jur kamot hak ki nyo ki ba pra ba khandai ki dap ki wan biang gini ki jing stam ki jing jur ho ka ba kham jur ka jing shit ka ba kham jur ka jing pangmet ka ba kham jur ki wan ka jing thaj ha ba ya ha ba yeng ki ba song din ki long ki ba pen pau shabar ba kadai ke jing stam ka ba bat kum kita ki dei ban wan kloi je hospital kata kadai ka jingkli ka ban kong ka pila patai ka pila kli ka jingkli ka ba ar pat hatu ki brio ki dang sngo ba ka jing shitam covid kadai ka ba top kadai shisha dok ba ong pi ba hadu kini ki sngiru ngidang yo I ba ki brio kidang ong kidang len bet ban ong ba ngam don COVID-19 kadai ke jing stam ko ba thok kadai ke jing stam ko syukor kadai ke jing stam ko ba ki brio ki ba penyat ya ka imlang salang ki shu thau na ka hau khnang ban kamai pisa te kadon ko wai ka sien ngani thu epi ba arngut shiyeng ki pang positive u kida shitam jur uwe na ki khon jong kata yang u up ya bro arngot po hospital te undala ya ki sngi I klat no I keme jong ta na but I tai men pate I jep te ha ka jing pat dot not u ong ba ngan phla ha khmat jong phi menta ba hadu kani ka sngi ba ka jing stam ka shin no ngam ngai satia bodan COVID-19 ngale sting ngale chaki yo hat ngam judeng mas ngawan chiyeng tang ka ktiru ka jan ngam kaliang ngam jubata tangi ka khmat ru handring ngan dalayo I kumno ka shimno ya I ba it ba thon jonga bat ngayo I kumno ki klat ki breu ki bathia hajan marjan ngaso songthu bang ala le bakla da pa nga sting bat ngale sting ya ke gor khoi te ka ta jingkala jong u pat u ong ba kala wan dear por ba ngala do ila join keme te ni nagaliang jong kinong sumar habang yo I ya ki kum kine ni don tang ka jingkentu ya ki pat ba to nai ngap shu nomor kadon ru ka jing ngan keren pat ba kum ne ba kadon hi ka jing sngo ba ni sngo kham sngo tanat ban nget ya ki ba ra ya ki jing penteng kum ka jat ban re ni sngo tanat ban sngo ban nget ya ki ba kham long negative ki ba kham wan ra ya ki bangin sngo ba ki dei ka bam shisha ne ka dei ka ba kai hendrei tongin ya kendet ban reu no nang ni shakhamat ban ong ba haba ki hospitals ki dap haba ki lom jing tap ki dap ngin nang kwa sakhi shu sakat no ngin nang kwa evidence shu sakat no ban ong ba ka jing stam ka dei ka ba shisha for the benefit of non-speaking viewers non-Khasi speaking viewers, regarding the first question regarding signs and symptoms of the COVID-19, we are now seeing that disease has a biphasic patient, whereby a symptomatic patient will usually have symptoms of common cold in the first few days of the illness. That is a mild headache, mild fever, a mild cough, a body ache, a loss of sense of smell, loss of sense of taste, some sore throat. They might even have features suggestive of an acute conjunctivitis, where they will have redness of the eye, watering of the eye, a bit of loose is also seen in the second wave. These symptoms usually subside by the third or fourth day, but in certain patients these are the ones who actually will require treatment. In these patients, the disease comes back after a few days of being asymptomatic. So by day 7, day 8, there is a resurgence of symptoms, be it breathlessness, be it a new onset fever, a worsening cough. They might have a little bit of chest pain and some hemoptysis, means they cough up blood. And this is the time where they need to come to the hospital as soon as they develop the second onset of symptoms, because these are all alarm signs to suggest a severe disease that is brimming inside our bodies. Again, we have been misled by a lot of people who have misled the public, saying that a lot of that what we're seeing as COVID-19 is in fact something that is made up. But we who have seen the patients, who have treated the patients, have seen the tragedies that has occurred in the COVID-19 treatment centers. We beg to differ. We have seen deaths that have in magnitude that we've never seen before. We have seen families shattered because of this virus. So I feel that we don't really need more evidence to say that, okay, this is something real, and we take it very seriously. Thank you very much, ma'am.
Well, thank you, Doctor. Even from here, and I can hear from your voice, I can feel the burden and the sadness within you because of what you see in the hospital daily. Doctor, we are with you. We pray for you also that, like you can have the strength to continue to support and to treat the patients that come to the hospital. At the same time, Doctor, last year we saw that it took, almost 6 months for cases to double. But this year, within a few days, cases double. And in spite of, the regular reminders of following COVID appropriate behaviors, people, they are still not following, and they consider that those protocols are not for them, like what you have just mentioned. Paralok kwa ban ong ye pi ban mangi ba pet ru ngi I ka jing khia jo do anwat jong I Dr. Meban I trei bat kitu ki ba pang ki ba shitom I duai bele buna ai bori I para ka jo ka poru na kwa ban kali ye I doctor bangi yo I ba men sham snam ka sham por ru benai ba kan long arsha kata ka jing pang jong covid rei mentap datang ha pedeng kap to ka nisngi ka jing kill step jong ka ni ka jing pang ka long hadu kata what la shi snam la hikai yaki pajba bakin penbuat renti yaki tu ki rukam deng yaki mas benda tap bahai ka shuntur tap bahai ka khmud om bandeng yaka mas hatmo om bandeng yaka mas hashkor tang hashkor banwa kum ki shoshkor lesi hendrai benda tap bahai yaki ban thet bahai ti ban kham penjngai hendrai ngi ki brio jungi kim kwa ban ngap yakata nakata ka daw doktor saka empat mengila ban le nakabenta ban yadai ledi nakani ka jing pang covid but batai khambania shapang kata kalat kumdo ka le ya ka met kaphat bakan ai kata ka jing yada. Doctor, we want you to explain to us, besides these covid appropriate behaviors, what else we can do to protect ourselves and to give an in-depth explanation on how antibodies are formed in our body.
Boleh sibun, doktor. Bangan jubab ya kata ka jingpi jongpi. Kuat ban ngin yelek biang sha kitu ki benai shwa ya February, March, April jong mencim snap. Bat ni pet dien kumno kalam. Haba ke COVID-19 disease kalalap siapa China, siapa Wuhan, dan ngi sayok sa kubor ba kalawan apa Kerala, din katu kat ni tayo ngi sngo kubor ka ba kaladon Assam. Tek ka ba kibreu jongi gile tu kapor. Pinda yo ya kisnong lakhang. Baro kimtre man suyami siya surok kat bakiyamon. Kata kajing kentu iwe ban deng mas kalong ka basit raham. Kajing long pikir na kaliang irang ba snong hakitu kipor kalong ke berhenti kabalong strict kaba penek ya ka o kabalong kim ailat banong ba menu bandan ba le kat bamon te ha gitu gipor laong yangi ba kejing yada kedai daki mask kaba site ikikti bat kaba penjengai lade bat banum ya lum hagi jaka kiba ya buan beriu lembrum hadian kata ngiyoi ya kejingwan jong ka first wave ha ubnai November pat ubnai December jala jongi ngiyoi kendiat nampak om shibun strain ong Dr. Robert udai native strain udang dai be itu virus uba rem uba empat kelador ya ladi uba empat pen kelador ya ladi te kejing ya bedru kam dai ka basa kriang kata ha keju kepor kejing sisen ba snow ba nambal alap balong positif ni yele ban ya bore yele de kenang ba ngin numla man pen sapriang shakiwe berpan hadien bang yo i ba kijing yap ki klem da bon bat kijing long positif kem da bon bat kadai kijing long breu hi bang i thaj no ban ong ba ngin sha set slam palat hakanu rukom ru te kadon ka e ka baki ong haktien pareng lockdown fatigue kemot ngi ngau thaj no ban le kita ki namat kemdai ki bangi ngi le ndo ban shu dai ki bangil ngi hap ngi pen bo de ban le thamai te ka wan ka poi ka pot ba ngim le shu e kata te haba u virus u la don hak imlang sa lang jongi but ngim ken ngim shim kia shisha ban le ya kita ki ban yada ya ladi bat ban yada ki ba it bathon jongi ngin dai na kata kadaw bangi sayo i ba kasapriang ni haka second wave te katu kajing yada boong ba yada daki mas daki jing sakti daki jing bom yada itu ko breu kitu kidai tangki ki bolong temporary ki bangi shule ban pensuki ke jing sapriang jong u knyang jing pang tat hado bangin yo ya ka solution ka jing pen kot ke jing yada ka ba khamlong scam tapi pilabang sungtu ban kham sungtu shu ngi laban ong ba ladang i don kam da ya ladi na uslam lada kampat don kanu ke jing yada kadang baha bangkup di syatri beren Taba ngikup syatri kamut bangim jhe syu ke jing jhe kanduna hendrai ongmut bangim jhe syu ngindang jhe kup syatri du kup stangela de itu bas hamarjan bayat lang bat nginum la setiaban da syatri yaki hendrai kat nang yat kapor ngindang yo kap ngi yo masnai ka yeng te hatu ngindala syong ha ngindala syong pat hayeng hatu ngim snow ba kata ka jing yada kalong ka bakampura bat ngila ban khot ya ki ba et bathon ale ri lang yu slap hapo ka yeng jongi kenang ba kiwei ru kinam jhe shu kata kalong thik kumjo lada ngi shule tang ki mask sanitizer bat kani ka ba ngi social distance ngin yada ngom dai bam yada ngin yada ndrai kai jing yada ka ba khamlong sani ka ba khamlong pura ka wan lengba vaccine bat nga shukwa ban ya thu hang ne ba to ki breu babun ki social media warriors yongi ki breu ki ba nongkom no ki ba penhe yala ki jong kisur na yeng naka jing shong suk hakashuki ban type po computer kila banong bon ki hendrai nga wan shakmat ban yathu yapi bahak ICU ka banga ngapen pat juyap uwei ru breu bala vaccinate baro ardos hatu katahi kamlong kasaki ban ong ba ka vaccine katrika I'll just summarize it in English. The reason why we have such a large magnitude of COVID, a large number of deaths in the second wave is that we have let our guard down following the first wave, and it was still a time when the virus is in our community, and at the same time we have no inherent protection from us in terms of the natural infection, natural immunity, and the secondary acquired immunity as a result of vaccination. Regarding why we are doing so, it is human nature itself to feel fatigued, to have the lockdown fatigue when we are forced to do things which we are not accustomed to, because all these things of wearing mask and social distancing is indeed something that we have forced ourselves to do. But yes, at that point in time, it was very important. It is still very important now, but it's time to get a more proper, a more complete, a more reliable protection. The vaccination is indeed very important. I also would like to state on record that as of this day, in the ICU that I'm taking care of, I've not seen even one death of a patient who had received both doses of COVID-19 vaccine. This itself is a testimony that vaccine indeed works. We have had almost 70 deaths in our institute, and none of these patients have been fully vaccinated. So vaccination is the way forward. Thank you, ma'am.
Thank you very much, Doctor. We have many listeners who are finding it difficult to follow the local dialect. So we hope that our panelists will also talk in English elaborately, as you have explained. But we are also short of time. At the same time, we'll be taking questions. We have some friends with us also who will be coming in live, and we call upon them. We hope that Ba Kores Marwen, who is from Riboy News, he can come in and ask his question. And for his question, I request Dr. Espala to answer. Ba lada long so bah kali kita kijing kali jong feel if you don't are like the least sin kali by doctor in yo ban jubab iki namar gidang bun ki pakwa ban keliru.
Baik, kublish bun doktor. Ajisha kakerteng jong adi Kores Marwen. Ngamdi bepersya new vaksin ngalad sim miladir vaksin andri kisai pan subun kijingkli kamtami kidong tok kubor kabaki paiba ki kwa bantip te hangni menta ga kli kijingkli na kabanta ki paiba jo gari boy district ki baro kawi te kawi kijingkli banukong kabaki barbor ki paiba ki kli yangi ba kin kwa bantip kalong ba hadu menta ka WHO kala petikna nem ya uni utika bolong babet ban ai ya kibreu bola ban ya da na ne klam covid kat kendai nangta ka bahar pat kalong kajikli ga dei lada ya ki vaksin ya kiwi tika ka simpor hadu ar ne license ban sna ban petikna bolong babet ban ai tika re kumno yo new vaksin lanu tika la tanghapo system la ban ai nanta ka jikli ka balai ka long hato yakiba dan akibadan dawai kibadang sya sumar kiba armen bat ya kibi kiba ai boin hato long babit nem ban ai une tika kita ke jikli kato ke jikli ba lengba ki paiba ki baju kli lagi man lagapor ko abu agar gapor namba ki paiba kin su sai
ta kuble ba marwe ni jingkli jongpi ta dan wok min te uneu tika ulong kumbang la batai phi ulong safety kani tika ka WHO kala list yu neu dawai inject tika epi check ha ka WHO website kila ong ba yu neu tika Covishield la wan pandan kam but yu tika wa na UK na kwe company jong ka Oxford University kum AstraZeneca ro kila ban pandan kam on emergency use kumba pandan kam hapo re India la bon la palat san phil kiri kila pandan kam yu neu dawai inject te ka WHO kala ai te ka jingkli ka baar pale ka important khendian kadai ka jubab ka jingkli ba bon na kibru warki doktor kili hi pale kumta ki chna vaksin tang si live na saub na hendri na system ma hene yu neu Oxford vaccine nu Covishield ke jing sna kalong la slem hai nu adenovirus ta virus de ba chu bangi yong kli mo kila don ki research bagi sna na ta ko influenza te handin la po gani ke jingpang COVID te kieu tu bola kila refine chwa man chwa kila at stang ya ka kendiet ke benta jong tu coronavirus but at hai tu i vaccine baki develop lupa na ke benta ke influenza na katak dau kiyo kham kloi ka jing lab ba ka new vaccine ka laban ai jingeda yaki brew haka phase 1 phase banangkong pat haka phase baar ta kani gede jing jebab ke baar mo tak de jing kloi jung ki kabalai ba pikeli ban ai yaki ba longkmi ba armet ba ki ba ai bun kade sisa ga jing keli ke ba bun naki pai ba namar ka sarkar menswa ka ong wat ai namar ngimpat tip ke banjia i khlung mo wat halu mentaro ka sarkar kadang ong hi yaki ba armet tengi hap perkhat swa ban ai namar da pisnyo baya gitu be longkmi ba armet ki don ka ris ban yo new jingpang COVID-19 mo jingpang corona te lahi ban ai yo new dawai inject namar ban ai inject kalong bakham ai jingeda na ka jingpang COVID khamtam ye gitu ki nongtre jong ka health department namar ki hap tre hospital ki ba armet kila ban ai tang ba ki hap chim ka ris mde mangin pen bor ki namar ki safety data ngimpat yo menta hande da pipet ki weki reader ki jait vaccine da ki we par ki vaccine kum ki Moderna lan ki we ki vaccine Pfizer vaccine da kum se US la ai ki lokmi barmer ro hande ngimpat yo ai ta ki dawai ki ba kum kita yaki ba ai bun ka sarkar ro ko ong hi bangila ban ai yaki longmi ki badam ai bun te yaki jing ai bun ka long kham safe namar phi ha por ba armet ni sai kier hi ban ai jing wat ki we ki jing ai tika jing eda ro ngi pen kier hi ha ko por ba armet hendre ko ma ong phi tengi kito ki longmi ki bakwa ban ai ki de ban access ye ka ris jongki daw doktor pakin tip ba mende orang don ba food ba haying songa ong la ban ai nei ye ba armet tenga ong ni hap chim sai keris ta keris ka hai ka ha ban ai inject ta keris kam don ka lu tengila ban apswa hende ye ki ba ai bun ngila hi ban ai ka jing ai tika kham tam ye gitu ki nong tre ha ki jaka ba kham long mo long risk ban yo COVID-19 namar da ki ai jinget dingi ai inject itu ki ba ai bun tu dawai untre niyo ke antibodies itu ki antibodies tekile si khelungu kam don kata ke jing mah do kata kumo ngi yo new dawai ni padang gunahi kita ki data hopefully ingin sayo kita ki data na po India ro na kena por wan hende de ki ba kalong ko ba kam ki start scientist ki om bahaba ai ban yada kam tam itu badan risk
Doctor, can you please explain in English also?
Okay, in English also, in short, this vaccine has been approved by WHO, have been listed in WHO World Health Organization website for emergency use, like for other vaccine also. Second thing is why it's very short time. This vaccine, adenovirus vaccine, it is modified from the vaccine which was prepared for influenza, like common cold. No? That vaccine has developed by, in the process by Oxford. So they have add just a S spike of the protein of COVID-19 virus into it, and that's why it will not cause any disease. So it gives us immune, it will trigger our immune. So that's why the time is shorter. I comment only for this Covishield. So the third part is how to give about pregnant women and lactating women. Okay, earlier, because of no information we have, not even slight information, so the government say we'll wait for them. But now, because when we give vaccine, some women by somehow they have got vaccine and they become pregnant also. So some data is there, do not much data. They see that there is not so much harm also on for the pregnant women to give vaccine, but it is not routinely advised. So the pregnant women have to really evaluate it by the treating doctors to see if she is at high risk of COVID-19, then she may go for vaccination. That is number one. For lactating women, the government also recommended that lactating women can give this COVID-19 vaccine, Covishield. So they can give, because when they give, they protect the mother also, and to some extent we protect the baby also if the antibodies. But we have not much data on this. But as I told you, there are some vaccines which have already used for pregnancy, like Moderna and Pfizer in other countries. But unfortunately, we don't have those vaccines yet here. So as of now, for pregnant women, we have to take precaution, consult your doctor and get vaccinated. If you are high risk, better to get vaccinated. So I think the question is answered.
Yes, but
Yes.
for lactating women, the guidelines have been given by the government of India.
Yes.
They
The
can take
government of
the
India
vaccine.
vaccine can be
Yes.
taken.
Yes, the kubleshibun doctor kubleshibun ya iba marwen mentang idon ya iba Rocky marwen ibelong I langba shnong jong ko umsning ngatip ba iba idon saukeli gejingkeli te gejingkeli beningkong wat baar dengan ailat ya doktor meban ba in jubab ba ya gejingkeli jong pi ke balai ke basau imat in jubab no ada I Dr. Robert ba so bhakeli gejingkeli keli syak itu arteli ba in jubab I Dr. meban sakeli pat arteli hadian dala adap jubab I Dr. Meban. Subhaban jubab lang dak paring rumah. Piaso ba Rocky?
Tak kebisibun ni doktor. Hai ngaya sengo doktor.
To keli jong pima arteli ba in jubab I Dr. Meban nang tak itu ki arteli hadian in jubab I Dr. Robert.
Tak jingkeli ke bang kwa ban bu benengkong kalong ba hato uni u vaksin ulong u basngan but hadu kat lo uni vaksin u trekam hakamet jungi kibrio. Kata di jingkeli benengkong. Jingkeli ke ba arpan kalong ba ke ka jinge per hapdeng ke first dose but ke second dose. But balay la penjelan no ya kapor jong u first dose sya kapor jong u second dose. Haba ka first dose men ha kani kapor ka bandingkong ki ong ba kadai tak arhu plasngi. Handai hadin kat tu kat ni por ka notification na government ki pala penjelan no sya kalai benai. Kita di jingkeli bandingkong bat baar.
Kublai ba marwen. Kejingkeli beningkong kalong hatu ulong ubasngan. Nei, tika hatu ulong ubasngan. Te kajubab kalong hoot. Namar hadu menta la ha India la palat arpo nyo glur kibrio kibala vaccinate. Hapo Meghalaya la palat sanlak nei kibala vaccinate. Ngi klem da shem setia ke ban pen ong ba kakta hadu kata ban ong ba kam long shu ban vaccinate ne ke jing ayu jong ya ke yo tika kan wan ra ya ka jing shitam ban ke jing bah. So ha kata kan nong rim nga ong ye pi ba kalong basngan te ki side effects jong ka vaccine yo ki side effects ki ba malumala kum ke jing thamet ke jing shit ngi kita baru khoj kidon ha kat tu kat ningut kibreu te kita ki ba ngilan ngila mansya ngila mansumar ha ko bayun nu jor jing yada jong vaksin ke jing keli jong jing keli ka bentar ka baar jong jing keli beningkong kolong hadu kat no uyada vaksin te pinda pet ya ki studies ki ba long latest ki ba penmi hidup kipen ba lada la vaccinate baro ardos ka chance ka jingyada bapin ong poi hospital kali nyop percent ka jingyada bapin ong poi ICU kalong hado kendai pusau percent but ka jingyada ban klat no COVID vaccine no COVID infection hadin bala yo COVID vaccine bro ardos kalong kum ong Dr. Robert 0.0002%. Kabamut ba ka risk pan yap na ka jing shitam COVID-19 hadin ba pila ay baro arteli gidos kalong ke ka barit shisha. Kidon kibriyo ki badang yo ya ka COVID infection what hadin ba kila ay ka COVID vaccine ru hendrai kalong tang ka jing shitam ka malu mala ka jing shitam ka ka jing shitam ka jur ngim da yo isu ha kini kinong pang ki bala yo ka vaccine te ka efficacy lada ingi pet ka im what is the target ka jing kwa jongi bangin yo ha ka bang yadai batu ha ka yadai batu COVID-19 vaccine kalong ba ki brio kinum do ialah ki jing im na kene ka klam ka bala penjulor ya ka shnong ka thau ba ka riba e jongi te lada kata kadai kathong ka bangi kwa ka jing yada ka bangi yo no vaccine ka long sha shispa percent kata ngak kadai bangi kinong sumar ni kwa bakan rung hadu kisieng jong ki brio ki basngam ka jingkwa lada ka jingkwa jongi kalong tang banumbun ki numbers te kata ka yada kunta nyo ko percent lada ka jingkwa jongi kalong nginong nang ne sakhamat kenno ka jingyap na u COVID-19 infection ka jingyada jong u COVID vaccine kalong shispa na ka shispa percent te jingkli ko baar kan mau syo pila ban repeat biang subha
kini kalong ba hatu pila batai meni apa kena ngaji keren asal kata kalong ba kani ka first dose kani ka first dose but ka second dose dai PPO ba ki babun hapo ICU ki ba PP pet na pi ki brio ki belayo artli ki dose ki ka recovery jong ki ka kloy but kam judon kano jingjam asumsi te menta ka government of India hadin ba u brio u belai ka first dose kila pan mi notification tang hapo arhu praski layo ban ai no Henry menta hadin pan ka extend sa live nai te kum kani ki berphai ken ka pen artatin ye ki babun balang but khaptam mi ba ka penduk mensim no ye ki tu layo ka first dose nomor beli ki apsa ba haduk live nai ka penlang ai ki te kata doktor ke bang pak bandu sekali
te haba ya day but ka jing ka gapping ka jing penia jingai no ka first dose ka second dose nei te na ki na ka khmat jongi ru ningkong por bang yoi na ka khmat jong ki pa le se ngila bon sngo ba ka penjalan ya kene ka first dose second dose nomor kaduna injection vaccines bon ki sngo kunta nreng indala pet ya ke ka bangila shem habangi pet ya kini ki immune response studies kamut habangi pet ya ke jing trekam jong vaccine haknet jong ubreu kapau ba hakasngi ke ba hakitu kita yo ki beningkong ki ba ar ki ba lai ke reaction jong kam vaccine ban yo ya ke jing ya da lengbau vaccine ka duna shisha te ha katayo ko balai basau basan manriu ter katu ke jing ya da ka nang kiu te ha ka ba ki sedang ningkong the first trials ka ba kile ki ai no hapo shibnai shiteng hapo arbanai yo iba ka kiu shu katu ka second dose ka penlong ba ka jing ya da ka kham klan Henry ki trials ki bami hadian jong kata pat ki pen i baladangi penjalan ya ka first dose but ka second dose ladangi ai ya ka second dose hadu lai banai lai ka jing keu ya ka jing ya da jong kitu ki sipai bala shna ha ka met hadian bala ai second dose vaccine lai ka khambon shu Kumut the benefit ka jing mentoi jong ka vaccine ka long ba on khambha ban ai kham slam khandiat andala khambon shu ki sipai ki bala don lupa kamet ba kalashna ka vaccine first dose tetal ka jing mi jong ka to order ban ong to ngin ya ayu vaccine hadu hadian lai banai da pila syai ka tangan keren maksud
hai la sai doktor kondisi ba la sai
thank you Ba Marwen for those indeed very important questions in terms of vaccine efficacy we are seeing studies now that the vaccine is 77% protective if given in both doses against a patient from even requiring hospital admission. And it provides protection to the amount of 94% against ICU admission. So if you have received both doses of COVID-19 vaccine, there is a protection, means your chances of getting hospitalized as a result of COVID-19 is reduced by 70% in patients who are vaccinated, and your chances of requiring ICU care has reduced to 94%. But again, I would like to stress that the more important yardstick by which we need to measure is the mortality reduction. If the aim of COVID-19 vaccination is to prevent death, the protection is 100%. There is a the risk of one dying after getting both doses of COVID-19 vaccine is only 0.000. So if we round it off, it's almost 100%. So this is what is the most important thing I want to set across to the viewers of today's discussion, that if we are to judge the vaccine efficacy, let us go by mortality, because everything else we can live with it. Patients will still be alive at the end of everything. Even if 33% still get hospitalized following the vaccination, still it's okay. But the reduction in mortality is 100%. So that's very important. In terms of why there is an increase in the gapping of between the first and second doses, initially the second dose was given only 28 days after the first dose was given. It was then extended to 6 weeks, and now it's extended to 12 weeks. The reason behind this is that in studies that were conducted to see the response of the body to the second dose of the vaccine, they found that if the second dose was given at an interval of 3 months, the immune response of the body to the vaccine actually is much higher compared to when it is given after 4 to 6 weeks. So going by that logic and by that finding, the government has made these important guidelines to separate the first dose from the second dose by a period of 3 months now. Thank you very much.
We are very short of time. I think I'll just take one question only from Pak Rocky. Ketua jingkeli ba hinkeli ya i Dr. Robert. Ba hadian kata pada dengan khot ya i kong ika ba inkeli mei ban jubab yang i Dr. Meban ya ketua jingkeli ke joki. Pak Rocky so ba keli da filong keli na da parang ya ketua jingkeli baki wei ken suthu.
Okay. Tak boleh sebut doktor. Kajingkeli ke bakadu, last question from my side. Does a vaccinated person, if he's infected again by the COVID-19 virus, is it a risk to an unvaccinated family members in the same house?
Rocky, can you repeat the question? Your voice is not very clear.
Yeah. Does a vaccinated person, if he is infected for the first time, if he's infected with this COVID-19 virus, is it a risk to an vaccinated family members present in the same house?
Yes, definitely he is still at risk, because and he, not only he, but his family members or anyone coming in contact with this person who has received only first dose of the vaccine are still at risk. Because vaccination, if you are not fully vaccinated means completing 2 doses of the vaccine 8 to 12 weeks apart. And that too, you will be fully immunized only after 2 weeks of the second dose. So if you have received just the first dose of the vaccine and you have been infected, you are still liable to transmit the virus not only to your family members but also to your friends and to anyone you come in contact with. That is why the government is reiterating on COVID appropriate behavior even after receiving both the jabs of vaccination. So ngan kren daga khasi manta iba ikli ba hatu ibala yo ya first dose jonga vaccine lada iyo covid kadang kadang long dangerous na am yaki bahayeng hasam jong i hooj lada pidang yo tang ya first dose jonga vaccine pidang la ban yo ya jingpang ru but hakajo kapor pidang la ban transmit ru ya kani jingpang shakiwe pada kiba phi shakiwe gibreo pada kiba phi shem takadaw ka sarkar ka ong ba lada pila ada vaccinate ru pidang dehi ban follow yagi covid appropriate behavior namar balai namar ba uniu virus usapriang tang lengba ki jenhau kiba mi hakapor ba fikran phi senria phi jerho takadaw kat hadu ba pimpat complete yaka second dose jongka vaccine kata kade hadien pra lane khat artayo jongka first dose jongka vaccine pidang de ban follow bha yaki covid appropriate behavior but ndala dep yaka second dose ru pidang hab hi ban follow bha ya covid appropriate behavior namar pidang la ban transmit you virus but pi dala deru pila ban yo infected thì kata ka de ka jingjubab jonga
Da kubli shibun Dr. Robert kapua kam shashu and ring in
Thank you so much,
shim gawe gajing kali kaba don kam bahan ne ikong ika subha kong ika kali gajing kali be in jubab I Dr. Meban ya kan gajing kali Piot snow kong ika Pi mute ya kam mic jong pi on mute ya kam mic
Yes, no, Dr. Rod. Good evening, Doctor. Barbarwa. Kating jonga kade rablang ikan ongkling na kran hangni na kapenta ki dong shung jong ka dong riboy but ke jing adon hangni a balai kli ki jingkli ba kwa ban kli ba kata ka long ka baning kong ka long ba ngidon kini ki paralong kami ki balayo e kini ki injection but hadin ba ki layo e ki injection ki ong ba ka period jongki ka menstruation jongki kam long regular show Dia nangta ki ongru baki septi yang bakani kanwan ra ya ke infertility ki. Hato kani kalong ka jingma ya ki ne kumno doktor. Nangta ngadon ka jingkali ba kan simpor hadu kano banyo jingkot hadin ba kilayo ya kani ka ba kilalong positive. Nangta ka ki jingbam ki ba kumno kin bam. Bakin la banyo kamplo ya ka ban pen klan sisyu ka immune system ka jongki hadin ba kilalong positive. Nang ta ka balai ka long ba kini ki balayo e ki positive ki long ne am bandi ba kiwe ki dawai namar ba ki don ki badon ki thyroid problem ki don ki prescription ki bala ai ki kiwe ki doctor ki long ne am bandi lang ba ki tu ki dawai ki ban yada na ka benta bandi na ka benta covid nang ta ki don ki jingli doctor ki pami ki ong ba haba ka sarkar lani ki doktor ki latip lupa ba kan kin sa ki kelung kena ki jongi kin sa syakta ha uni covid de hato ki la don ne am ka precaution ka ba ki la pun kret na ka benta kini ki kun kelung kena ki jongi kita ki di jingkali na kalyang jonga doktor kudai shibun
kubli shibun kong hakabaya day
Dr. Meban kindly answer
hello
Yes we can hear you
Blay shibun kong hakabaya day bat kata kajing kundrum kundram kajing poi banai te haduk menta ba ngin yo I ya kita sebaki wan ngin pada yo I satya Andre kawai kajing ajing mut na kalyang jongi kalong ba ya kita kiba don kum kita ki kajing ngop her hakamet kidai ban what shaka kiba kila ai ka vaccine but ba na kalyang ka kot kya ngila ba ba kadai shisha ke ba non vaccine lani kadai tang ka jingjar khat namar habala ai bon ki vaccine ka don bai ka jingjar khat coincidence ki ba ya hap lang ki jing pher jang kamet but bang issue snow ba ka ya hap ka vaccine te lada ngin num budien adu kata budien ba bangin suong bait ba ka dei ne kam dei nginum la satya banong hendrei hadu momentahi ka ha ka ba dei bat ka jing pen kunrum kunram ka jing nai thai bat kilong keme hadu menta ka report skim pat don na keleng ka perthai ru ha ka ba dei bat ka jing ong bam yo khun bam yo khun hendrei ka ka ba ngila yo I wat haki hastit jongi wat haki jaka ki ba ngi trai ngi kta ki ba yang bahasem la don ki brio ki ba la da armet menta mun hadin baki ai ko yo vaksin kila da yo ya kila da yo kata ka khubor ko bhaba kila armet te ban ong ba ka vaksin ka penlong yaki bakin long lingki em kadai ka ba bakla kadai ka jing sungthu bakla jongki brio ha ka boya dai buat bon ki jat jing stom nai ka bon ngasih yo bon ki jing kli na ki nong pang baki ong ngadi dawai sini hatu ngalong ne em ngadi dawai thyroid hatu ngalong ne em ngadon jing pang TB hatu ngalong ne em ban ai ngadon ki jing pang sini ngadon ki jing pang cancer ngadon ki jing pang khlai ki jing pang liver than rei ka wei ka rukom perkhat wa pin wa ngakwa ban pensyai ka long ba kita brio ki badi dawai na ka benta ki wei ki jingpang maki hi ki dei ki high risk category kemud dei maki hi ki ban kham shitom jur wat na preng jom ki hi ki paidu ka do jong ela ka mensim na COVID-19 te ka bodon shisha ban ai ka vaksin khamtam lada pidon kiwe ki jingstom te haduk mentahi ke ba ka sarkar India keempat sya kalong hapo ki ya hapo ki snem ki ba khat prasnem syapo but hapdeng ki long keme ki badang armet ta te kita group nomor ka data keempat wan ban ong ba kalong ne kamlong te yaki kidang apshwa te ha ka ba yadai so badon ki boong ba kadon ki jingpang ITP ba ki low ki platelets ka hatu kalong em ban I vaccine ka jubab ru kalong hooj provided ka platelet ka kalong halor jam kasan poja khambha shu la da dei halor sila it should not be a problem kalong kumju hi kumbai vaksin lada di dawang snam kini ki penstang ka snam badi ki aspirin ki clopidogrel long ban ai vaksin shulong ni compare kalong ba hadin ba ai vaksin ni ban khnyot itu jaka ba ai vaksin kumasan minute kanang ba kanum don kenja bleeding te ha ka ba yadai ba kata ka jingkli ka ba khatdo ka ba pi ongkong ba don ki ba ong ba ka third wave kan yada bon kan kta bon ki khna ki khulung te tongin ya perkhat lang ke tharai mengila onle ban ba kanum poi kata kawei kalong ba POE hi ba ki khna ki ba hapo khat prasnem ya ka vaksin ngimpat ti kena hatu kalong ne kamlong ban ayaki te ko hadu menta ka sngi ompat long ban ayaki te ke ka bangingin le kum kirang ba namar ki khna bun sin kim sa marwei hiyen ki don kirang ba ki don ki me ki pa ki pa ye te lada ki don ki khna hayeng jadi klik kalau kamjur bapin ya da ya la de bapinum yo itu vaksin but bapin macam kena te kajing don kam hagani lada pidon ki kena lada pidon ki kelung lada pidon ki armet yen kata ke population ba kimla ban ai vaksin wat lada ki kwae te kajing ya da ya ki jongi ki bala long ban la ya dai la di te kani ka por nga kentu ba wan shakmat ban ai ka vaksin khamtam la da pidon ki khna ki khlo ba ki ba armet haye I will repeat what I said in English. One doubt that was raised by one of our esteemed citizens and callers was that a few of her friends have complained that they have experienced some menstrual irregularities after COVID vaccination. As far as studies that are available in our country and from abroad as well, we have found no correlation between menstrual irregularities and COVID vaccination. However, it is something that it's yet to be explored. So I would urge all the viewers to also tell your friends and family that if you experience such problems following the COVID vaccination, it is very important that you tell these problems to the centers where you got your vaccination done, so that they can follow you up and see if there is any correlation between vaccination and indeed menstrual irregularities. Because right now we are vaccinating people on a large scale, so coincidences are also known to happen. So it is our duty from the health side to figure out whether these things are just coincidences or they are actually associated or caused by the COVID vaccine. In terms of whether the vaccine causes infertility, the answer again is no. We have not seen any statistically proven data to say that it causes infertility. In our experience, there have also been people who have been vaccinated a few months ago who are now with the good news that they'll be expecting a child in the next few months. So in that aspect also we need not worry. In terms of whether the third wave will bring about children being infected by COVID, and whether there is anything that we can do to prevent that, my answer is very simple. These are a population in which they have not been approved to receive the COVID vaccine. So children and pregnant women. So even if they want to get the vaccine, it is still not available to them. And it is a fact that this population, the children and the pregnant women, are not living alone. So the people who are living with them, it is their responsibility to make sure that these vulnerable population are not affected by COVID. So it is very important to not ignore the mask, to not ignore basic sanitization measures by the family members. And at the same time, I feel the people who are living with children and with pregnant women have an added responsibility to vaccinate themselves to prevent any other problems from happening. So thank you very much, Kong, for your valuable questions. Kublai Shibun.
Thank you very much. Kublai Shibun Kong gitu gidi jingkeli shisha giba dondor, bagi jingkeli giba don kam hiban jubab. Ngadon gini ki jingkeli giba wan naga email. There are some questions that have come via email. I'll be reading them, and any of the doctors can answer. Maybe these are one word answer or 1 or 2 line answer, so that we will not lose time. We will be having some live questions that will be coming on the screen, and for that also I request doctors to please answer before we wind up. Now, one of the question had come from Kiara Krem. Her question is this: I have been taking homeopathic medicine for a year now for hair fall, and I want to inquire that can I continue again with the medicine after taking the vaccine, or should I finish my second dose first? I look forward to hearing from you at your earliest convenience. Dr. Robert, can you answer?
Yes, Kong, I think you can continue with your second dose as scheduled, because I feel the medication you are taking has nothing to do with vaccination. So you please continue with your second dose. Protection, I think, is the key. So you need to be protected first. Forget about the hair fall for the time being, even if you have to stop your medication.
Okay. Another question is from Motiram JC. She has asked this question. I am an SLE patient taking medicine as prescribed by a doctor. She's taking prednisolone. She's taking HCQs. She's taking telmisartan. My query is it okay for me to take the COVID-19 vaccine? If it is okay, can I continue my medicine after vaccination? Dr. Miban?
Yeah, yes, it is very safe. It's actually very important that you take the vaccine. The same way that I am guessing that your treating doctors would have also given you the vaccine. They would also have prescribed that you take take the vaccine, influenza vaccine, it's in the same way very important that you take the COVID vaccine as well. And by no means should you discontinue the medications for SLE also. Please take all the medications as prescribed by the doctor.
Sekawai ke jengkel linga thai kan ru in jubab I Dr. Meban kan ke jengkel liga wan nau Samuel Suchiang ba ong kom ni ba menta ki bon kiri ke perthai kom ga Canada ke Denmark ke Norway ke la kentat ben penan kam ya Covishield namar ba ki ong ba tang sudap ya ka second dose dan ki bayo blood clot tingi shani padeng ya pendan kam da kan ni ban ngaru ngal adap ka first dose TKA pidan ban pensyai halor kan ni na menta ta ka blood clot
Kublai Shibon Samuel. Kung mangalaong man kaniya kadi ko ngi ay ya ka vaccine solensar kumot ngi ay lut ya baro ki bala day banyo. Now ka jingpang blood clot ka be it arterial be it venous ka don bet ha ki brio ki bobon kumot lada pipang siniru ka chance of nyo blood clot ka bon lada PD ki dawai steroids ru na kinu daw kinu jing stom ki long bobon lada phila sha pon but pishong klem ki lais ngiru ka chance of afinyo blood clot ka de ka bobon te what kini ki brio ki ba let jinglet ki travel da ka flight ki klem ki like palat like benta nak takadaw ki da filet jingai da ka bus ru ki penyeng bapinyo ya pinyo sa ki kijat kini baru khot kila ngila don evidence ba kilong high risk for blood clot in blood. Tekata mo ong ipi meneru to nginum ngau thula ban ong ba kadai na vaccine sudah rengkat ba vaccine. Kata ngi don kam man perkat. Te lada ngiyo I kumba hapo Canada ning kong kiong kata. Lada kiyo I ba ka bon shisha haduk kata beyond the baseline rate. Kamut lada hakipo vaccine ru nakasilak ngot ubrio bayo stroke bayo heart attack pulmonary embolism DVT kilong suppose ship hongot. Lada I vaccine nakasilak sangut tengila bonong hatu kadai nagu vaksin. Hendrai lada laai bot vaksin ru kene shiphaungot kita gi blood clot te kamlong satya daw jong vaksin hendrai kadai tang ek bejarung khat bat vaksin. So the concept of association and causation is very important hakabaya dai ke ba rai da medical community. Kemudian habang ile research ngi punya pair ya ke ba sujarang khat bat ke ba day nakadaw jong tu ti ya kata kidon ki vaccine menchua ki ba kilap ba kadon shisha ka side effect ke ba season long statistically significant kemudian ladang ila pentikna ba ka day shisha no tu vaccine dan kano government dan kano ki doctors ru nomor hakaba kut hi ngia trei sitom ngia songmet ngia do bam do di kedai bakit kot ki para mensim jongi teladang ngi lap shisha ba kedai kata isu tang ke basu yadai basu jarang khat kedai nak kedaw jong ni vaksin nga nganlong beningkong ong ya imei ipa imi ipa watsim hendrai maki kila simlut baro khot imei jongai la yo covid proses yang klaim nilai kendiap lu te kita ki jing kentu na kaliang jong iba ba ya day but kini ki very technical kini ki bolong bafin sngau bangin sngau thu kini ki bolong jeliu kam shong nginum la ban sngau thu da ka bangi puli ya ki WhatsApp bangi puli ke Facebook arminit la hikai ya Dr. Robert daki khatsan khat reus nem tang ban la ban sumar ban sngau thu ya kini ki ba khamlong jelleu te asotona to hikli ya kata jingkli hendai ka jubab jonga kalong kumtai leave the technical things to the technical experts and mdai wanshu ngap leng baka ayu te hak ba dai batu blood clot ru bon kiri kila le ya lagi jong ki research kila shem ba kam don ai kabayat ong ba dai no vaccine dai ka dai tang sujarang khat rengkat bat ubrio vaksin na ka daw jong ki risk factors ki ba kila don lupa haki met ki jong ki borok kata
kata kadi jubab kabashai bahai. It is a very clear explanation. I have one more question before we see the live questions, and that question I want to ask by myself. We have seen so many people claiming on social media that after receiving the jab, they have got superpower and they're able to attract metals. Dr. Pala, can you clarify on this? Can you say something about this magnetic effect that they
Okay,
have?
so the answer is very short and sweet, no. So because we have less time, and there is no other. This is just
Yes.
maybe people showing that there's nothing like that.
Okay, so like that kind of a video that we're seeing, we are also experiencing a lot of fake news, and that is very difficult at this time to tackle because people are really not listening to the news that we are giving them, the views that we are giving them, the reasoning that we want them to see, and they are more interested in the comments and in causing a lot of difficulties for people to analyze what is good and what is bad. So I hope that by hearing and by listening to this kind of panel discussion, they will come to some sort of understanding. And if they have any kind of questions, you can write into the NHM Meghalaya. You can write by email and you can put in your questions. Maybe another program of panel discussion can be done. I request the person controlling the screen kindly give the. Okay, we have seen one question. This come from Wan Pai Nongro. Doktor, kiba pang kansar, kiba dang don hapdeng ke jing sumar, kila ni em ban ai tika. Dr. Pala? Or Dr. Meban, okay, please explain. Dr. Meban, you can say.
Hai. Kibapang cancer kilong ban ai. Kidai ban ai. Provided kidai ban namar sien bal ai happening ka jing ai jing pang sumar jing pang cancer. Kila ban yo chemotherapy, radiation therapy. Kidai ban pentikna ba kim dai ban dan kanung infection. To kamtam hi ka jing shit kadai ban num dan ha to kopor baki ai. Ki blood counts ki dai ban long normal sha bakin ai. Ma these ki kamlong vulnerable ki nopang. Jing yada kan kam kung san yaki kum bala ong menehi.
Ngaku aban at kendiat hang ni. Kumbala ong ni Dr. Maban. Shua ba ngin yo ega vaksin ngide ban screen shua yala di. Mah namar ngisham ba bon nakibawan ai vaksin habaki dan yaki symptoms kiwan ai ega vaksin. Ti yo let's say kila dan lupa ya kata jing pang ru ngimtip. Ti takadaw lada ki dan kano naki dak kishin jangka covid kimde ban lej ai u vaksin. Namar kala ban kata yaki ajaka ban benefit kala ban nang kata shu ya taman.
Jingkali pada Neikong Lolita Shangpliang. Doctor, I keep having vertigo off and on. So if I take COVID vaccine, will I get vertigo after the vaccine? I'm scared that I may black out, Doctor. Dr. Pala, kindly answer this.
Okay, if she already had vertigo, yeah, she may had it. It depends on the treatment. See, that is the already. This is the peculiar thing. She's already have the disease. Ladon lupa ka jingpang mo. Don hik jai jingpang ting ki priu ki ong dang alayo vaksin la duna kata ka jingpang. Don hik jai jingpang ki kam dunaru kum ki jingpang join ne kino. Ta ka we ka banong ham ne katu ka jing ong jong ti kong mut kala hi ban don bu mar kala don lupa mo sa ka vaksin. Ngaka banong kendiat. Ikibal ai vaksin da hiyo ka covid ru phi duna ka jing sa priang na iwe cheiwe. Namar ka viral lu ka duna te phi kene gare ka jing mentoy wang iyo. Kakak pedong kumbang Dr. Sibola di phang tu ki social media. Ini kalong ka ba ting le ran ban i wan ki paratre health department ngi share ki fake news. I have seen in different groups. So kerpat ki mo list ki batre ka kol ka kya nim dei ban share group ye ki tu ki news ki ba ting le competition. Amano ban share swa tu kalong ngila ban avoid. So I also try to avoid many a time. Sometimes tempting but good to avoid.
And I think Kong Lolita, vaccine will not cause vertigo. Maybe if you are scared or you have some fear, maybe that will cause you some kind of blackout. But the vaccine itself will not cause you to black out. Kani kawi gajing kali na ay dabok lengkhoy kidan baong baka vaccine India version hana kalas tang san benai. Kadai mo doktor kata. Dr. Robert?
kong ai dabok ya kata te hadu mentang impat la ban ong mo ka vaccine kadang thamai. Lot of studies is still going on regarding this vaccine, but of course kabang itip hadu menta kalong ba nda pila yo ya ka full immunization hadin ba piyo ya ka second dose ka protection kala ban ne palat ya ka khandai posngi kata hadu mentang itip.
Okay, from Reach Along Ministries, we have one question for Dr. Meban. Can people living with HIV and AIDS take the vaccine?
Alright, ma'am. Kila banshim. Kumbang yong hi, the only contraindication for vaccination is age less than 18. Namar ngimpat dan data baha. Pregnant woman, again, ke data jongi kampat long kabapura, ta yang mentang ngimpat laban ai. Hendrai palat nang ta, unless don kibriyo kiba don severe allergies to many drugs, to many food, and habong allergy mdai basu mi knyang basu dai. Allergy kabalong ba poi hospital, habu ICU. Te yakum kita kibriyo, the risk outweighs the benefit. Tang hakum kita kibriyo hi ngimdai ban ai ki vaccine. Hakiwe ngilong bai ban ai. Again, kumbang Dr. Robert, kan mau ba long ban ai ka vaccine lada don lupa symptoms of COVID-19. Makanya di ka pandemic borok ki don ya ka COVID-19 lada kumbaong menai Dr. Robert ru nyop ho 100% le kim tip hira ki don ru ndai lada pila tip lupa ba pi sngo bayong clear so jar ho shit tamet tapat sngo ha vaccinate mentah up katogan nisngi test lada sngo don ka Hendrai ban ayu vaksin hakum kita ki cap ngidai ban ya ker ngidai ban num ya le kata te especially for HIV AIDS very important that we give the vaccine namar kini le ka resistance na le ka long lupa ka ka beduna ba ka jinglong jong jing stam ko panlong ba the native immunity jong ka metru la pan hiar do knyang jing pang HIV vaccination will indeed help kum ngi vaccinate ikwi jing pang ru.
Okay. Kublai shibon ye pi baro ki doctors badan hang ni ai kublai ru yang mata ka NHM ba ki baterai bat ka ki bala penbiang penbit ye kini ki kor ki bor ban pendep ya kini ka program ye ki lenti banang ni syahmat nin nang yo ka jing ya trailang jo ki pat ba makin wan syahmat ban ai ya kini ka inject ka bayada na kini ka covid khat kandai. Friends, we have come to the end of this panel discussion. Thank you for listening to us, and we hope that we are able to debunk some of the myths and able also, to give the reality of what COVID vaccination is. And later, if there are more questions, maybe more of such panel discussions can be done. Thank you to NHM and all the staff of NHM and viewers. Good night and stay safe.